Well, the U.S. and several other countries are bringing back COVID-19 restrictions for travelers. ABC's Elizabeth Schulze shows us what those new rules entail.
The U.S. is issuing new travel restrictions on passengers from China as the world's second biggest economy grapples with a COVID-19 surge. The CDC announcing starting January 5th, anyone arriving from China 2 years or older will need to provide airlines with a negative COVID test result upon departure, taken no more than 2 days before.
Given the fact that we don't have clear data about how much COVID is circulating in China and what variants are circulating, I'm not surprised that the CDC has taken these additional steps to keep the United States protected.
Several other countries are imposing similar restrictions. Italy pushing for an EU-wide testing requirement after more than half of the passengers on 2 flights from China to Milan this week tested positive for COVID.
In Italy, until now, the incidence of COVID was falling. It was absolutely under control. And then now there is a new situation brought about by what happened in China.
The new measures reflect growing concern over China's soaring number of COVID cases and a lack of transparency from the communist government. The head of the World Health Organization is also expressing concern about China's COVID spread.
WHO is very concerned over the evolving situation in China, with increasing reports of severe disease.
China has stopped publishing official COVID data, but images show hospitals overflowing with patients.
And we need high levels of transparency to protect the people of China and ourselves, and we're not seeing that from China.
Another complicating factor in China is vaccines. The country has declined offers from the U.S. to import mRNA vaccines like Pfizer and Moderna that have proven to be more effective in fighting COVID than Chinese-developed shots. Elizabeth Schulze, ABC News, Washington.